Thank you, Mr. Speaker. I ask for unanimous consent that all members may have 5 legislative days in which to revise and extend their remarks and to submit extraneous material into the record.
Objection.
Thank you. I'd like to begin by yielding to Ms. Capter.
I thank the gentlelady for the courtesy, and today I rise sincerely to thank 218 House bipartisan colleagues for signing Discharge Petition 8 in order to force a vote here on the floor for a long overdue vote on the Ukraine Support Act. Liberty for Ukraine hangs in the balance, and for NATO. For 12 years, Ukraine's people have valiantly endured Russia's savage war to eradicate Ukraine, its children, and Ukraine's very identity. Today, as Ukraine's forces continue liberating stolen territory, our bipartisan petition represents strong congressional support for Ukraine's defense of liberty. Vladimir Putin must stop and end his horrific invasion of a free nation. And I am confident that this bill will pass this House. Let me thank especially Congressman Steny Hoyer, Don Bacon, Brian Fitzpatrick, Kevin Kiley, Mike Quigley, all those in the Ukraine caucus who fought so long and hard in our bipartisan support for Ukraine that transcends party lines. All 218 signatories have the gratitude of the American people for freedom lovers, the whole of the Ukraine nation, and freedom lovers around the world. Let us now pass this bill with dispatch before the end of next week. Mr. Speaker, I proudly yield back for the moment.
This past Sunday, millions celebrated the work, love, and support mothers give to their children and families across the country. There are so many ways, seen and unseen, that mothers show up for their families and care for their communities. I know that I'm incredibly grateful to my beloved mother and for the privilege of getting to be the mother to my 3 wonderful children. Appropriately, Mother's Day also marked the beginning of National Women's Health Week. This provides the opportunity to highlight women's health, reflect on the progress we've made, the ongoing research we need, and to commit to the continued advancement of access, quality, and affordability in women's health care. Advancing women's health and delivering the best possible care requires a strong collaboration between the many caregivers and entities that have built and continue the work of advancing women's health care. One organization that has been an indispensable partner to all obstetrician gynecologists in their quest to provide the best evidence-based care to their patients over the past 75 years is the American College of Obstetrics and Gynecology. Over its 75-year legacy, ACOG has never wavered from its foundational mission of advancing the quality and consistency of care for women through guidance, education, and professional collaboration. In the early years of its existence, ACOG set out to create evidence-based standards and develop opportunities for clinicians to continue their education. Growing scientific progress and an expanding focus on women's health opened doors for the organization to serve as a leading voice as the nation experienced historic advances, like the FDA's approval of the birth control pill and the Griswold versus Connecticut decision that established the right to privacy and therefore the right to use contraception, which had been illegal in Connecticut and many other states prior to this decision in 1965. As these events established the policy landscape for women's health, ACOG continued its work standardizing prenatal and cancer screenings, introducing its own academic journal, and establishing the requirements to achieve high honors in the field of obstetrics and gynecology. The landmark Roe v. Wade decision, as well as the establishment of the Title X program, which was the first federal grant program in the United States dedicated to providing family planning and other preventative health services to low-income families, both elevated women's health further and supported ACOG's efforts to expand access to reproductive health care to all Americans, regardless of their ability to pay. They also amplified the importance of understanding the causes of maternal mortality and working to decrease it. During this time, ACOG was at the forefront of building reliable, trusted programs that help standardize evidence-based medicine, integrate cultural competency, and strengthen policy partnerships. ACOG's role in women's health was also extended to helping protect the patient-physician relationship. From the critical influence of the Doe versus Bolton decision, which was the companion case to Roe v. Wade, in which the Supreme Court struck down burdensome procedural requirements that effectively made abortion completely inaccessible in Georgia, even if the patient's life or health were threatened, to the mobilization needed in the aftermath of the Dobbs decision in 2022, which overturned Roe. ACOG serves as a trusted source for evidence-based guidance for care across the lifespan for patients and providers alike. Both turn to ACOG for information about critical topics ranging from contraception, cancer screening, STI screening and treatment, obstetric care, best surgical practices and advances, nutrition, abortion care, vaccines, menopause care, and everything in between. In its continued pursuit of advancing women's health care, ACOG has championed work to understand and address the systemic issues vulnerable women and populations face. Through pioneering initiatives like the Committee on Health Care for Underserved Women and the recognition that health is deeply impacted by factors beyond biology and clinical care, ACOG was an early leader in establishing opportunities for communities' lived experiences to be heard and incorporated into our understanding of disparities and how to address them. As ACOG expanded its focus on reviewing and understanding the impact of systemic inequities and disproportionate burdens of maternal mortality in minority communities, ACOG continued its work of building robust and responsive clinical guidance and programming that centers respectful care and quality improvements. During times of transformational advancements like the development and approval of the HPV vaccine, the Affordable Care Act, and historic investments in maternal death prevention efforts, ACOG has led and helped expand key collaborations and partnerships. Mr. Speaker, I would like to yield the floor to my colleague, Ms. Pedersen from Colorado.
Thank you. Mr. Chairman, I rise today to recognize Women's Health Week and the catastrophic impact Trump and Republicans have had on women's health in this country. This week, the Trump administration launched moms.gov, another performative political stunt pretending to support moms. But the health and well-being of women and families has never been under greater threat than under this administration. Our access to health care is being decimated with cuts to Medicaid and the ACA, while women are also dealing with the ongoing consequences of the Dobbs decision across this country. And somehow it might even get worse. Republicans are working on a back-end national abortion ban by trying to eliminate access to mifepristone, an abortion pill that is utilized for 63% of abortions in the United States. This move will disproportionately impact women in poverty, women in rural communities who face significant barriers to being able to see a doctor. Despite their lies, we know that mifepristone is a safe, effective medication, but access to this life-saving drug now hangs in the balance before the Supreme Court. Any restrictions of this medication for miscarriages and abortions will be another devastating attack on our ability to make our own decisions about our health, our bodies, and our futures. Let's be clear that this has nothing to do with science. It is about controlling women and taking away our access to reproductive health care and our ability to make our own decisions. During Women's Health Week, let's remember that Donald Trump has consistently put us last. And as a woman, as a mom, and as an American, I am horrified. We cannot stand on the sidelines. Thank you, and I yield back.
Thank you. Mr. Speaker, I'd now like to yield the floor to Mr. Conaway of New Jersey.
Thank you, Mr. Speaker. And thanks to my friend and colleague, Congresswoman Morrison, for coordinating this special order hour. I rise today to recognize the 75th anniversary of the American College of Obstetricians and Gynecologists, better known as ACOG. For 3/4 of a century, ACOG has been at the forefront of improving health and the well-being of women, mothers, and families across the United States. Since its founding in 1951, ACOG has helped to shape the standard of care in obstetrics and gynecology, advancing research, physician education, and evidence-based medicine. Every day, OBGYNs across our country provide compassionate care through every stage of life, from birth to infancy, then to adolescence and adulthood, from pregnancy to menopause, and beyond. As a physician myself, I know firsthand the critical role that trusted medical professionals play in keeping our communities healthy and informed. And it's certainly critical, their role certainly is critical today as we see from this administration so many attacks, I would say, on the ability of families to have the information, to gain the information that they need to protect their health, the health of their families and communities at large. We have moved away from science as the foundation for decision-making in healthcare, and that terrible trend, that tragic trend, needs to end. ACOG has consistently worked to ensure that physicians have the tools, training, and guidance necessary to deliver the highest quality care to patients. Their work has helped to reduce maternal and infant mortality, improve prenatal care, expand access to preventative screenings, and advance women's health outcomes nationwide. At a time when maternal health disparities continue to impact far too many families, particularly Black mothers and their children, and others who live in underserved communities, organizations like ACOG remain essential partners in the effort to build a healthier and more equitable future. Now, I know I mentioned I'm a practicing physician. I've had to call on members of ACOG to help provide help to women, certainly as a legislator at the state level for 26 years. I work closely with ACOG on everything from medical malpractice reform to obviously dealing with the tragedy of the disparities in Black infant mortality and for Black mothers who are pregnant and delivering children. Their work to provide standards of care to guide decision makers not only in the healthcare arena but in the legislative arena to improve outcomes for all people, and particularly those who are on the, shall we say, who suffer from disparities in our healthcare system. We owe to ACOG a tremendous debt of gratitude. We owe a gratitude to the doctors, the nurses, the researchers, the educators, and advocates who have dedicated themselves to this mission for the past 75 years. So I want to stand and commend ACOG for its decades of leadership, service, and advocacy on behalf of patients and physicians alike. Congratulations to the American College of Obstetricians and Gynecologists on this important milestone, and I wish the organization continued success in the years ahead. Thank you, and I yield back.
Wonderful. Thank you, Dr. Conway. The last few years have brought unprecedented challenges and rapid change. During the COVID-19 pandemic and in the wake of the Dobbs decision, ACOG held strong to the foundational mission that has driven its work for decades, strengthening equitable, accessible obstetric and gynecologic care. ACOG's presence and leadership during these pivotal moments for women's health and the profession they've represented over the last 75 years has helped translate the life-saving scientific advances and give evidence-based guidance and stability to a profession that is, and will continue to be monumentally consequential to families across the country and in every congressional district. Reflecting on the incredible progress of the last 75 years also brings to the forefront the importance of the work still left to build and expand. Despite the incredible advances in women's health, challenges and obstacles to fully achieving the mission of equitable, accessible care remain. An estimated 36% of counties in the United States are maternity care deserts, meaning they do not have a hospital or birth center offering obstetric care or any obstetric providers. 2/3 of these maternity care deserts are in rural areas that are also the most vulnerable to disruptions in services and hospital closures. Approximately 1.2 million women live in counties with only one OBGYN. By 2035, The estimates are that 44 United states are projected to not have enough OBGYNs to meet those states' needs, with the most severe shortages being in rural areas. Women in many communities are already traveling long distances to access prenatal care or to deliver safely in a hospital. In the wealthiest country in the world, in a country built on the principles of human dignity and freedom, these alarming statistics can and should lead to a unified, bipartisan effort to address them. We've seen how the work and legacy of ACOG and its members have helped support historic achievements while upholding the core goals of access and quality of care. Facing and overcoming persistent challenges demands a commitment to science and evidence-based practices, for setting the standards for OBGYN care, for advocating for policies that advance the field, and empowering physicians to provide patients with the care they need, all while building on each of these areas to inform continuing education opportunities, refine clinical guidelines, and continue the evolution of the field of obstetrics and gynecology. Beyond navigating increasing administrative burdens, burnout, and workforce instability, OBGYNs are having to deal with health and medical misinformation, jeopardizing their work and their patients' well-being. Patients are increasingly exposed to misinformation about contraception, fertility, pregnancy care, menopause, vaccines, and reproductive health. This creates fear and confusion, undermines trust, delays treatment, and poses real risks to patients and families. That is why trusted scientific leadership matters. ACOG and generations of physician researchers have helped translate rigorous science into evidence-based care that improves outcomes for women across the lifespan. Throughout my career in medicine and public service, I've worked to support evidence-based approaches that deliver for families. From championing expanding Medicaid coverage to 12 months postpartum in Minnesota, to advocating for the reauthorization of the Newborn Screening Saves Lives Act in Congress, I've advocated for advancing early intervention and prevention to save lives. Healthy mothers, healthy babies, and healthy families strengthen communities, reduce long-term healthcare expenditures, and improve the long-term resilience of our nation. I had the privilege of caring for patients as an OBGYN for more than 20 years. So I've seen firsthand the challenges patients face to afford and get the care they need. I've seen the impacts of some of the medical breakthroughs and improvements to care that have occurred over the decades. And I've seen how social determinants of health make it so difficult for many Americans to have good health. As an OBGYN, I've seen my patients directly benefit from practices that were built on decades of research, clinical trials, and the dedicated work of multiple generations of my fellow OBGYNs. These advances were the result of hard-fought advocacy and awareness campaigns, committed work from researchers and physicians, and patient voices being centered and truly heard. One of the great privileges of my years in practice was caring for my patients across different stages of their life. OBGYNs see patients from adolescence through adulthood to end of life. I've cared for patients that I delivered through to their own pregnancies, and I've cared for many through early adulthood to midlife, through perimenopause and menopause and beyond. ACOG has been there every step of the way to provide evidence-based recommendations to help guide my and my patients' decision-making. In the decades I've spent in this remarkable profession, it's been my sincere honor and privilege to provide the care my patients needed, from prenatal care through labor and delivery, to contraception, to hormone replacement therapy, from the exam room to the operating room, helping patients through important life stage transitions, creating care plans through shared decision-making, always working to meet patients where they are to meet their unique needs. ACOG has been a critical partner throughout my career and the careers of many thousands of OBGYNs across the country. In a rapidly changing world that's marked by advances in technology and access to an avalanche of information, not all of which is accurate, it is difficult for many of us to fully understand how drastically circumstances have changed for women and how transformational historic moments were to women's health and safety. Younger generations of Americans and even some older Americans may not be able to recall a United States without protected access to birth control or an HPV vaccine. My career as an obstetrician gynecologist began at a time when foundational concepts in public health and clinical practice were better defined, and elements critical to progress like the right to privacy and the ability of women to make their own independent healthcare decisions were protected. In the last decade, as women's health rights and protections have been threatened and eroded, I'm thinking of my patients and of people across our country. I'm remembering my patients who disclosed, in some cases for the first time in their life, their traumatic experiences prior to the protections of Roe versus Wade. I'm thinking of my younger patients who worried about the possibility of losing protected access to abortion care as the Supreme Court ruled on the Dobbs case. And I'm thinking about the babies I delivered, protected by vaccines from preventable, life-threatening conditions, and the mothers spared from complications because of comprehensive, evidence-based clinical guidelines and access to comprehensive care. And I'd be remiss if I didn't take the opportunity to remind everyone in this moment when access to mifepristone is threatened, the research on mifepristone has not changed. It has been an FDA-approved medicine for a quarter of a century. It has been used safely and effectively by millions of women around the globe. For my entire 20-year-plus career as an OBGYN, mifepristone has been used to help women manage miscarriages and safely end pregnancies. Its safety record surpasses most over-the-counter medicines. What has changed is the people in power. People with no medical training who want to undermine access to health care, control women's bodies, and ignore evidence-based science because of their own personal ideology, putting their desire to control and restrict women whose lives they know nothing about and who they will never meet, over facts and research and safety. It sets a very dangerous precedent for us all. As we celebrate the milestones of the last 75 years of ACOG, we also have a responsibility to face future challenges head-on, mindful of all that we have gained and conscious of what is being lost, unwaveringly committed to improving the lives of all people seeking care, their families, and their communities. So I offer a heartfelt thank you to ACOG for 75 years of always standing with patients and physicians, and for its ongoing work to improve healthcare and the health of our patients. Onward to the next 75. Mr. Speaker, I yield back.
The general